Happy Friday. Hope you all are doing real well. Hopefully you can hear me today. We don't have any lawnmowers out back. Nobody's trying to run us down or stifle our conversations. As you'll see, Dr. Crouch is not with me. He's spending some important time with his family, so we wish Dr. Crouch and his family all of our best. Give him all of our love. So you may have noticed that I've sort of been in and out of the office a little bit, and we mentioned a couple weeks ago how I had taken a trip to Washington. Well, I have actually just also taken another trip to Washington, so each time we go back it's with higher and higher levels of the federal government, because frankly they love what it is that we're doing here and what folks around us around the country are doing to provide affordable access to care for large amounts of people that were not able to access medical care before. And in this last visit, we actually had a meeting with the White House. Now, again, I mentioned before, we're not trying to enter politics into medicine, but, unfortunately, it's probably not a wise decision for us to take 4 to 8 years off to develop our healthcare policy because of who's in office or who's not in office. So we're going to go ahead and work with anybody and everybody who will listen to try to fix what's broken in our healthcare system. So, Miss Ann, who is holding the camera, what is probably the most common question that you get from new potential patients that call the practice? Is it about coverage and
Yeah, they would like some sort of health insurance that would marry us, our direct primary care, kind of wrap around what we offer. Something affordable, but we take care of them for their day-to-day, and then they have hospital coverage for the emergencies, the accidents.
Right, so we take care of all the stuff that most people need on a daily basis, and they just want some major medical, some wraparound, just something just in case, hospitalization, they need surgery, they're hit by a bus, God forbid, they've got something, and that something wasn't available. Well, in my recent meetings with the White House, sat down, and first of all, I probably should say that the guy I met with said, "Didn't I see you give a lecture in Grand Rapids, Michigan about 3 years ago?" Yes, you did see me give that lecture in Grand Rapids 3 years ago. But he said, "Have you been paying attention to these short-term medical plans? And you notice we extended them from 3 months to 12 months. That's within our ability without congressional action, so we can actually give you access to a major medical health plan." He said, "We did that for you. We had you in mind when we made those changes, because that is what we have the ability to do without Congress, which does not like to do their jobs these days." So the interesting thing is that we were celebrating. We finally have something that we can tell our patients, yeah, go to healthcare.gov, look for short-term medical plans, you can renew them annually. It's just major medical, it doesn't cover really much of anything else. Marry it with what we've got, it's a perfect match. Well, every single major medical organization came out blasting this plan by the administration to expand access to these short-term duration medical plans, and they came out saying that 6 million people were gonna lose their coverage because of it, that it was going to destabilize the health insurance marketplace, and that we were creating bad plans for people, and so they received hundreds and hundreds of complaints from organizations, and really nobody in support of them except for us. But what I can tell you is that this is what we've been begging them for a long time. It is definitely a missing piece to what we've been providing. And so one of the things you're going to probably hear in the next few weeks is they're going to be announcing new changes, new health plans that are going to be coming out. And they're going to announce them with some excitement, and it's going to be met with very great skepticism because of exactly what I said. But these are the types of things that we've been asking them for, and they've answered what we've requested. And so just read the headlines with a grain of salt. These are good plans for our patients. We'd like to see people having more access to these major medical plans to bundle with us. And so if you have the opportunity to support or refute or any sort of argument against these plans, we'd appreciate the support, because we really want them to continue to offer plans like this, and hopefully Congress will act and expand access to more affordable care. But in the meantime, direct primary care in combination with these wraparound short-term medical plans that you can buy today from healthcare.gov are definitely a good marriage for us. So that's all I have to report. I don't think I have any other plans to travel back to Washington, but lots of local travel plans and lectures I've got given in Orlando and Fort Lauderdale coming up in the next week, and then I think I'm going to actually be back here to be full-time practicing medicine again. So thank you, everyone. Have a wonderful, safe weekend. Appreciate all your support, and looking forward to having Dr. Crouch back with us.